Welcome. My name is Abby Kaiser. I am the Director of Family Life Services. I oversee three departments at Kobe's, which includes Resource Home Unit, Family Life Education, and Counseling. I have the distinct privilege to talk with you about childhood mental health. So, one of the thoughts I really want you to take some time to reflect on is the quote that you see on your screen. It says that mental health is not a diagnosis. Rather, it is an assessment of concerning and puzzling behaviors which you, as a resource parent, need to be able to navigate to determine the line of defense for the child. So, if we think about mental health in this regard, what we are doing is basically we're like a first responder. We are actually thinking about what is going on with the behaviors of that child, what is going on that is puzzling to us, and then really trying to come up with a plan to determine what is the best way to assess that particular behavior and that particular need of that child. Common mental health disorders for foster care children include ADD, ADHD, attention deficit hyperactivity disorder, PTSD, post-traumatic stress disorder, anxiety, depression, autism spectrum disorder, oppositional defiant disorder, and obsessive compulsive disorder, otherwise known as OCD. During this presentation, we're going to review each of these common mental health issues and also give you some tips and also some pointers and considerations as to what you can do to be helpful in the process with foster children in your home that are diagnosed with these mental health disorders. Let's start with attention deficit hyperactivity disorder, or ADD ADHD. These children appear restless many times. They may be restless because they're not understanding what to do next. They could be hyperactive. They almost look like they're on a trampoline, going back and forth from activity to activity, and they cannot stay settled in order to complete something. When they're involved in an activity, they could appear disorganized or very agitated. This may be because they want to do well, but they just can't pull themselves together in order to complete it. These children also have a difficult time sleeping. They have a difficult time going to sleep, and they may wake up throughout the evening. If they're school age or even in preschool, they may have poor concentration. They may not be able to finish a worksheet when a teacher asks them to complete it at school, or maybe during homework time, they're having a difficult time completing something. They also may have a high physical activity. They need to move. Their muscles need to move. They need to be doing something, maybe fidgety. Maybe their feet are always moving. Their hands are always moving. These are very typical symptoms of ADD, ADHD. The next common mental health issue for foster children is post-traumatic stress disorder, or PTSD. This is when a foster child either experienced or observed an event which involved actual or threatened death or serious injury to themselves or someone else. Or a child may remember the trauma or relive the events of the trauma in their mind through distressing dreams or other forms of psychological rehashing of the event called a trigger. There are many evidence-based treatments for PTSD. The two main evidence-based treatments that we use here at Kobe's in our counseling department are trauma-focused cognitive behavioral therapy, or TFCBT, which is typically used for children ages 3 to 18. This particular type of trauma treatment is when a child is able to learn how to self-regulate, be able to express their feelings, and then they actually create a narrative of what occurred as far as the trauma is concerned in their life. And then they tell this particular narrative to their caregiver. We often don't want to do that particular piece unless that caregiver is going to be an adoptive resource, and we know that that child will probably be staying in that home, in that forever home. The other type of trauma treatment that is used by our therapists is EMDR, or eye movement desensitization reprocessing. and this is used for ages 16 and above. Many of our therapists have been trained, and actually a couple are completely certified. Our therapists are certified in TFCBT. We're excited to be able to have these particular evidence-based modalities that we use right here at Kobe's Family Services. Anxiety disorders usually affect children between 6 and 11 years old. That's usually when you start seeing anxiety occur and begin. This is typically characterized by excessive worry and anxiety over a variety of things, including grades, maybe performance in sports, family issues, or even environmental factors, of maybe a sound they don't like, maybe a texture they don't like. Those would be different types of environmental factors. Typically, a child cannot control their worry and it will interfere with their normal activity. So, if they are in the middle of an activity and they come off the field or they stop the activity because they're worrying about something, obviously we want to make sure that we are trying to decrease this anxiety as much as possible. They also are very restless. They may feel fatigued, maybe have an inability to sleep, difficulty concentrating, maybe irritability, and muscle tension. Again, as you can see, many of these symptoms overlap with other mental health issues. So it's really important that you talk to your caseworker and you really think about, does this child need an assessment from a professional? Major depressive disorder symptoms include self-injury, avoiding trauma reminders or things that might remind them of something that has happened in their past. They will have much social withdrawal or being anxious around individuals. They also will experience emotional numbing, and you will see them not be able to communicate feelings and or even be able to express happiness or joy and not really be able to understand maybe the feelings that they're having internally. These children will also have sleep difficulties, and those are the main symptoms of major depressive disorder. Oppositional defiant disorder symptoms include angry outbursts and irritability with no predetermined reason as to why they should have gotten that angry that quickly. So you may see a child going from 0 to 100 as far as anger level within a 2 to 3 second period, but there's no reason as to what just happened. They also will argue with adults and actively defy or refuse to comply with adult requests or rules. They may deliberately annoy people, and they will often blame others for their mistakes. And so, if they do not want to take any responsibility, which is a part of oppositional defiant disorder, they will blame others for the mistakes that they have made. Obsessive compulsive disorder is a disorder when a child will experience either obsessions meaning ongoing, continuous thoughts about something, or compulsions, and that's typically an action like hand washing, having to do things in a specific order. And these children, these particular behaviors interfere with their normal life functioning. Again, obsessions are those persistent ideas, those thoughts or impulses that intrude on their thoughts or impulses. And compulsions are those repetitive behaviors that are performed in an effort to reduce anxiety. Many times, obsessive compulsive disorder, these repeated behaviors help them feel in control. And as you can imagine, a foster child may feel very out of control because of new surroundings, new environment, new rules, just trying to feel comfortable. And so sometimes this happens with a foster child, typically because they want to feel in control. With autism spectrum disorder, the typical symptoms are the following, as you can see on this slide. A child will have deficits in social, emotional, being able to go back and forth with an individual, ranging, for example, from abnormal social approach and failure of normal back and forth conversation, to reduce sharing of interests, emotions, or affect, to failure to initiate or respond to social interactions. These children just have a difficult time with social skills. That's the bottom line. And they have a difficult time making eye contact as well as being able to reciprocate a conversation back and forth. They have deficits in nonverbal communication behaviors used for social interaction, as well as deficits in developing, maintaining, and understanding relationships. They may not be able to understand what is appropriate in this situation, what is not appropriate in this situation when it comes to maintaining and understanding how to continue on with that relationship. They may have repetitive motor movements or use of objects or speech, and they have an inflexibility adherence to routines. So if a routine is going to change, it's very difficult for them. Routine is really an important piece for those on the autistic spectrum disorder diagnosis or mental health issue. They highly are restricted or fixated with different interests that are abnormal in intensity or focus. So they may have a Rubik's Cube, but instead of just turning it and looking at the colors, they may actually focus in on one side and stay focused in on one side for a long period of time. And then they may turn it. So it definitely is more of an intensity of focus or abnormal when it comes to what an individual that does not have this disorder would look at when it comes to an object. They also would be hyper or hyperactivity to sensory input or unusual interest in sensory aspects of the environment. Sometimes if lights are too bright, that will bother them. If sounds are too loud, that will bother them. So they are very sensory oriented. Again, with Kobe's Family Services, you will go through trust-based relational intervention, which is a resource parent curriculum, and you will learn much about the sensory pieces of foster children and what you need to do to be helpful with those particular issues. Now that you understand the most common mental health issues for foster children, we want to give you just a few tips for you as a resource parent. Remember, work with the specialists that have experience with children and mental health needs. There are many professionals that are going to be involved in your life. It may feel a little bit overwhelming at times, but remember the long-term goal is to help this child get stable, to help this child feel loved, and to help this child feel connected. Anything we can do to help get them onto the proper path of development, we want to make sure the professionals that are needed to be involved are involved with that child. Number two, seek and be open to a range of support and education from professionals. There are going to be many opportunities for you to take different curriculums, different educational pieces. We encourage you to be involved in every single aspect that you're able to be involved to continue your learning and knowledge. You will also have a resource parent trainer, and that parent trainer will meet with you either weekly or bi-weekly, and they will help you adjust to the needs of that child, not only for you as a person, but also within your parenting skills. And also be open to, but not solely focused on medication. Remember, medication is given at times to stabilize the child so that child can self-regulate so that they're able to learn the skills. Medication does not mean it's going to be long term. It could be, but maybe not necessarily. So don't just stay focused on the medication needs to be adjusted. Also think about all the other things that are happening in your home, maybe happening in their school if they go to school or in preschool, and really try to take a good big picture as to what you need to do to make sure that the right professionals are involved. Other considerations as a resource parent are to be an active member of your child's mental health team. Be sure that you are connecting with your resource parent trainer on a regular basis. If you're able to meet with them weekly, meet with them weekly. If it's every other week, then meet with them every other week. If you have a team meeting, be part of that team meeting. These are support systems that Kobe's has in place for you. As you see to the right on this slide, this is the Kobe's difference. Be proactive. Make sure that you tell your caseworker and your resource home specialist what you and your child needs. It's really, really important to make sure that you're using all the support systems that Kobe's has in place. The third thing is take good care of yourself. We cannot emphasize this enough. There are times where you just need a break, and we recognize that. Children need parents who are healthy, strong, stable, and able to model good self-care. So if you do need a respite weekend and you need a break, it is okay to request that. If you need a night out, it is okay to request that. It's very important that you have good self-care. Make sure that you're doing your best to stay on that regular routine of whatever your good self-care is for you. Mental health conditions are generally manageable if the child has the support and has reached an accurate diagnosis. So it's really important that once a diagnosis is made, that you're following the professionals. If there are any concerns, that you're reaching back out to those professionals, you're reaching out to your caseworker, you're making sure you're reaching out to your resource parent trainer to really talk through any concerns that you may have. Think about how you can connect with the child. Use the TBRI concepts. And remember, this is trust-based relational intervention. That is the first major curriculum that is mandatory for you as a resource parent to go through. Use those principles to connect with your child. We know that if those principles are used, connection will occur. It will take time. Remember, this is a mountain. There's going to be some valleys. There's going to be some really prosperous times, but there are going to be some times where maybe it doesn't feel like that child's growing, when in actuality, they really are. So just allow time to occur and be patient. We hope that this particular presentation gave you a good overview of common mental health issues for a foster child, and that you understand maybe some practical considerations that you want to think about as that child is entering your home.